Hello, my name is Amanda McDermott. I'm an RN in the cardiac catheterization lab at St. Joe's Hospital. I've been an RN for 6 years, and I'm currently in the family nurse practitioner program. I chose anxiety, generalized anxiety disorder, for my chronic condition. I was going to choose something in the cardiac field because that's what I'm most comfortable with, and I've been working in that area the entire time I've been a nurse. But I wanted to choose something that would, teach me a little bit more and something I'm not as familiar with. So I chose anxiety. I also have experience with this disorder in my own family unit, so I thought this would be a great condition to kind of research on and look at the different resources. So, and as far as when I become a nurse practitioner and a patient comes to me with a mental illness, as a provider, I want to be able to help guide them and show them different things and resources that that can assist them. So I found this association. Um, I really like it because it's multidisciplinary. So they're one of the only multidisciplinary organizations. Um, and so you have your for the public and for professionals, which I think is great. So you can, as a nurse or as a doctor or, anybody in the field, you can get on here. They have all different tabs easily accessible up here, and you can look through. They have depression, anxiety journals, and how to become a member, clinical practice reviews, teaching tools, and other resources, which I think would be great. And you have all these resources here. Master's levels videos. I was looking through all this. Teaching slides. The ADA pediatrician outreach resources. They have PowerPoint presentations and customizable brochures. So this is really, you have a patient come in and you have a disorder, and you obviously might be referring them out to psych, but it would be great for you to be able to kind of get them some information. And this, to me, looked like a really great place to start. So, and also, I did know in this area of research and practice, they talk about different clinical trials. So it's just nice to stay up to date on all the new information that's coming out. So if I was focusing more on for the public, so Triumphing Over Anxiety and Depression is the website name, and the organization is Anxiety and Depression Association of America. The site is very credible for many different reasons. I scored it a 3.8 on the SEER, and I only just took a little bit off, but I honestly think that it would score more so a 4. There's no ads on the website. They're not referring me elsewhere. You don't click on something and it brings you to another site. A lot of the information is all the information is well referenced and written by authors with expertise in the content area. You're not clicking on something and it's bringing you to an article written by whoever else out there. It's written by authors that are actually working for this organization. So it's original content, and the viewpoints on the site are highly respected as a source provided to inform others. So like I said, I scored a 3.8 on the SEER, which is good. So if I'm going back here, the ADAA is a nonprofit organization. They're dedicated to preventing, treating, and curing anxiety, depression, OCD, PTSD. They work with all different professionals, which is wonderful: neuroscientists, researchers, nurses, social workers, therapists. So I think it's great to be able to get a broad spectrum of the different disciplines. And obviously we all have our different viewpoints to bring to the table, so that was good. So there's a lot of topics on this website, but I really like that it's easy to read. You've got these colors and easy accessible tabs up here. So you're going to start with understanding the facts. You click on, say, tips to manage anxiety and stress, because we were talking about generalized anxiety disorder. How to deal with stress and anxiety. So you have mind, body, and action. These are nice, visuals. We talk about the different ways people learn, and they don't want to just necessarily sit and sift through words. So you've got visuals to kind of help you and guide you through, which is great. And it's a great teaching tool as well. You can use this to teach families about this disorder. So still in the same area, you go through and they talk about symptoms and treatment. If you want to click, like I said, there's many different kinds that they talk about, but if we were going to, panic disorder, specific phobias, stress, depression, but we're going to focus in on generalized anxiety, understanding the facts, what exactly it is, treatment information. And like I said, here's some of the example of the reputable references that are listed. So it's a lot of information there. So then you can go to find help, which I think is great. Find treatment, types of therapy. So we click on types of therapy here, and it gives you a therapy option guide. So you can walk through, what kind of therapy you're newly diagnosed with anxiety, or your daughter or your son, a child of yours is new to you and you want to get them into therapy. Are they somebody that likes to talk to somebody? Or is the person somebody that wants to communicate, doesn't want to see someone in person, they want to communicate via texting or phone or a video chat? It walks you down very easily through each of these, and it gives you the different options of different therapy options. And all this information on who to call, and it's just throughout the whole website there's information on what you can do. There's a form of therapy, cognitive behavioral therapy. It seems to be a very effective form of treatment, but something I didn't even know a lot about. And there's a ton of information here. So you can kind of tell the families, we're not going to be the ones treating them. We're not necessarily, we're going to be sending them to a therapist, but they can get an idea of this information before they go and can have an idea of what they can ask. So speaking, with the cognitive behavioral therapy, I did notice that it can be very, very expensive. It can be up to around $100 an hour. So then you can go here to low-cost treatment, and it's going to tell you about therapy where they do sliding scales, and the therapist will base their wages on how much you make. So everywhere you can click right here, and it can find a therapist near you that does that. A federally funded health center. Prescription drugs, maybe the child or patient needs to go on a new medication, and these medications can be outrageously expensive. So then they're linking you to different drug companies and their prescription savings programs. So really a plethora of information and resource for this. And then it also talks about clinical trial information. So being a part of a clinical, all these areas are areas you can click on. So you being a part of a clinical trial will get treatment for the family member at no cost. Obviously you have to be a part of this trial, but it gives you all this information about it and how you can search for different trials in your states. So that is a great resource for patients that are looking for that. Also in Find Help, so it's easy to walk through all this information here. If we're going to do, and you can look through different age groups, so children, teens, girls, and women. Then we're going to go to Learn From Us, and this is going to give us all different, so we have webinars. This might be, people learn different ways, like we said, so you might want to watch a video about these depression among college students. The video might resonate more than the brochures or the reading material. So that was a good, there's so many options, videos, again, for people that learn different ways, and it's giving you all sorts of information. So then you can go back over to Learn From Us, and something that I really liked was the plethora of brochures that they offer. So go here, and it's going to give you a whole list of these different brochures. So if I want to click on anxiety Disorders in Children. This is going to give me a brochure. And you can print this off and have it in the office for the family to go over, because this is going to be, like I said, you might be sending them to a therapist, but this is a condition that we will be seeing quite a bit. So you want to be familiar with it, and you want to be able to kind of coach the family and talk to them about what this is. This is a big change for not only the patient, the child, but the family unit as a whole. So they're going to walk you through all this information. It's medication warnings. A lot of parents are going to be terrified when they find out that their kid, no one wants anything to be wrong with their child, let alone hear that their child has to be on medication. So it's going to talk about those concerns that the families would have. And here are some questions to consider asking. Like I said, you're going to be sending them maybe to a therapist. They're not going to know. A lot of these parents or families have never had any experience with that, seeing a therapist or any area there. And we know that, the mental health can affect their physical health greatly. So we want to be able to really be on the positive end here, helping them out and coaching them to get them the right help and therapy that they need. So here's some questions to consider asking. Like I said, kind of coach the family. Will my child have to take medication for the rest of her life? Again, these are big changes in the family unit, and we want to be able to help. We want to be able to ease their fears and help them through this new diagnosis, and how life is going to change here, life in school, anxiety disorders in school. So there's just a lot of pieces to the puzzle when it comes to a diagnosis of any kind of chronic condition. And so we want to be able to be there for them and have these resources. So sorry, I'm going kind of fast here, but these brochures are great. I looked through a bunch of them, and I would love to use them. And we've talked about in educational classes, speaking, when we educate at a 5th grade level, and definitely everything on this website it speaks that way in the public area. They're easy to understand, easy to read, just a great resource. So I really liked that the brochure area as a tool, but like I said, you can also use the webinars, the videos, books. Personal Stories of Triumph, these were really great. I watched a bunch of these. I could go on and on from this website. It's a very uplifting website, and somebody, like a diagnosis of anxiety, might be very stressful and hard to take. So it's nice for people to feel like they're not alone, or the families to feel like they are not alone, and to know that there is help. There's other people out there going through the same thing, and we can be a resource for them in helping them navigate through. So I really enjoyed this website as a resource and as an educational tool for future patients.